Hello, this is Dr. George Rogu from AdoptionDoctors.com. Today I'd like to speak to you about persistent diarrhea in the orphan or foster child. The question that was put to me from an adoptive parent was that my child is 20 months old and has a problem with persistent diarrhea. He had a post-adoption medical workup and nothing came back as positive. I just do not understand why his bowels are so loose. Is there anything medically wrong with him? Unfortunately, chronic diarrhea is a very common problem in many of the post-institutionalized children. Causes can vary from medical concerns, dietary intolerances, psychological situations. In a pediatric medicine in general, children have usually only one medical problem at the time. In the orphan children that have lived with many years in institutions, several different medical conditions can occur concurrently. The normal stool forming pattern for children in general is 1 to 2 times per day. When this frequency increases to multiple times per day, large amounts, foul spelling with little consistency, diarrhea would be a diagnosis of concern, regardless of the fact that the child had an initial evaluation that was negative. Some of the common things that may cause recurrent diarrhea in the internationally adopted child could be a multitude of issues. If the diagnosis is made appropriately, the proper medical therapy can be implemented and subsequently resolve in a chronic diarrhea syndrome. Overeating is the most common cause of recurrent diarrhea. Adopted children are known to be fixated with food post-arrival. Sometimes they seem to be a bottomless pit. One must remember that food for these children was scarce in the orphanage. When it was available, it did not taste very good. Now these children have an endless amount of food available, and most of the time it tastes pretty good. They do not know if they'll ever have this meal again, so they just eat, and eat. Catch-up growth in these children is always very dramatic. Growth parameters tend to take a vertical pattern on the growth charts. Diarrhea secondary to overeating can only be made once the medical concerns are ruled out. Sometimes probiotics, such as a product called Floristar, this may help children overcome their complaints caused by dietary changes. Toddlers' diarrhea is another common cause of recurrent loose stool movements in the general pediatric world. It is even more common in the adopted child because, like with foods, they tend to drink large amounts of juice. Apple juice is a common drink that is given to the pediatric population, and it is notorious for causing toddlers' diarrhea. The recommended therapy of choice is to limit the amount of juice. Diarrhea caused from dietary intake is also called osmotic diarrhea. Both the above-mentioned causes of diarrhea can only be made once other medical concerns are ruled out. Medical concerns that need to be looked into are mentioned below. Giardia enteritis, which is a parasitic infection of the bowel, commonplace in children that live in orphanages. Infected children in the developing parts of the world are generally not treated for this organism because it has such a high recurrence rate. Once a child is diagnosed with a positive stool specimen for ova and parasites, as well as a positive Giardia antigen, therapy can be initiated. The therapy of choice would be metronidazole or other newer drugs called Alinea. Metronidazole is complicated, so it's not easily obtainable medication. This medication must be specially compounded by a pharmacist. It has a foul taste and needs to be administered 4 times a day. A newer and better tasting medication is called Alinea. The company states that the child needs to be treated once a day for a total of 3 days. Personal experience with this medication is that a longer course of therapy is generally required. I had spoken with the medical director at the company who stated that, especially children from Russia, they seem to carry a resistant type of Giardia. They require longer therapy from the very beginning. Milk protein allergies is another common cause of recurrent diarrhea. In children under 2 years of age, cow's milk protein allergy is very common. Adopted children in orphanages are often given different types of milk products. Such examples would be kefir, soy milk, and sometimes goat's milk. It is only until they arrive in the US that the new adopted parents introduce whole milk to their diet and that intolerance to milk protein is discovered. Eliminating cow milk from the diet and supplementing it with soy milk or rice milk can easily manage children with this condition. Lactose is another temporary cause of diarrhea and is generally following a course of antibiotic therapy, which causes an intestinal infection. This condition is found sometimes in children adopted from China. There is a deficiency in an enzyme called lactase that is used to process the digested milk products. A lactose-free diet and the use of lactate supplements when enjoying a milk product should be sufficient to control these symptoms. Sorbitol found in medications such as INH, which is used to treat a positive PPD reaction, is another common cause of explosive diarrhea in adopted children. I've had cases where we were treating the child's positive tuberculosis screen and it caused explosive foul smell and diarrhea, and we had a negative stool workup. A simple remedy to this problem is to have the pharmacist compound the INH using a sorbitol-free preservative. More serious conditions such as celiac disease, cystic fibrosis, malabsorption syndrome usually present with chronic diarrhea in a child that does not thrive at all. The one thing that many internationally adopted children do is thrive post-adoption. When they do not, that is a red flag to your physician. Once a qualified pediatrician determines that the cause of the child's recurrent diarrhea, only then can the adequate therapy be implemented. One should try to stay away from foods such as the following, for they may upset the child's bowels when they have diarrhea: raw foods, fruits and vegetables, juices, sodas and milks, greasy fried fast foods, spicy foods, sauces and sweets. Things that help to alleviate the upset stomach would be small, frequent meals, rice, pasta, hot cereals without the milk. The bread diet is usually routinely administered in the pediatric medicine community. It stands for products made from bananas, rice, applesauce, and toast. Plenty of fluids such as electrolyte solutions, Pedialyte, are good to help ward off acute dehydration caused by prolonged diarrhea with poor liquid intake. It is not the treatment of diarrhea, however. Again, the exact cause of diarrhea seems to be investigated before an appropriate course of therapy can begin. The above examples are just simple common causes of the recurrent diarrhea in the internationally adopted child. If one would look into the pediatric medical textbooks under differential diagnosis of chronic diarrhea, you will find a list that has about 30 to 40 different medical conditions associated with diarrhea. In general, the child will get better with time.